How would you handle a decision to live or die for yourself or another? Since we have the ability to keep people alive and to live longer, this has become relevant for many of us. Our next guests have faced this challenging question and are here to talk about it next on Lakeshore Focus. Welcome again to Lakeshore Focus, a weekly show highlighting the key issues, important events, and interesting people in our region. I'm Keith Kirkpatrick. The topics of death and dying are sobering and incredibly challenging. They become even more so when we talk about the choice of living or dying. Some of you have already faced these issues or are struggling with them now. Our world has become very complicated since we can keep people alive longer even though the body and mind have ceased to function. We think about quality of life for the patient and the ones who care, not to mention cost and strain on resources. With us today are two women who have dealt with, talk about, teach about, and coach people through these issues. Let's meet Susan Zinner, a professor in the School of Public and Environmental Affairs at Indiana University Northwest, and Bev Hmurovic, who is the president of the Indiana chapter for an organization called Compassion and Choices. So thanks both for being here today.
Thank you.
I'm looking forward to this topic because I think this is a really important topic that I hear people talk about all the time. And this is really relevant to both of you because you've experienced this. Susan, you and I worked at IU a number of years ago, and I remember you were married at the time, and then I think I was leaving, and then something happened to your husband.
Right. So we had been married 5 years, and he was diagnosed with esophageal cancer. And it's one of the bad cancers because there aren't very many symptoms. So by the time he was diagnosed, he was already stage 3. And he had a surgery that removed most of his esophagus. But like many patients, because the esophagus is surrounded by the lymph nodes, the lymphatic fluid is moving through the body, carrying cancer cells throughout the body. So while we initially thought that he would do well, it became clear that he was not going to survive. So
This sounds like a nasty kind of cancer.
It's very bad. There were very many trips to the emergency room. He had pulmonary emboli, so blood clots in his lungs. If they had moved to his heart, it would have been, fatal. So very many side effects. He lost 60 pounds in a couple months. So very serious sort of illness. And when it became clear after about 2 months that he wasn't going to survive, he started thinking about options. He had seen his father die of lung cancer in a lot of pain and really struggling to breathe. And it was just, it was not a good death. And he knew that he didn't want to go that way. And he wanted to have some say in the manner of his death. So his doctor, we were at a hospital downtown, his doctor gave him some options. She was a hospice doctor. He was an inpatient hospice patient, which is a little bit unusual. And she told him of an option called palliative sedation, where patients can choose to be sedated. They're given very high levels of morphine, and then they stop everything else medically. And because patients are so ill, they usually die of some other complication. Like in his case, they thought it was probably an embolism. So they're kept comfortable and sedated, and they die of something else. And
the morphine pretty much puts you out,
right? It
right?
controls the pain, so he was in no pain, but one of the side effects is that it decreases respiration rate. So the breathing eventually slows down.
Was he conscious?
No.
Okay.
At the beginning he was, and then eventually as they had to increase the morphine, then it slowed down to nothing.
How hard was this decision for you to be part of?
He called me up at home and told me this is what he wanted to do. But I had been teaching death and dying classes at the university, so I was very pro patient autonomy. So on the personal level, it was very difficult. But I'm a real patient advocate, and this is what he wanted. So if this is what he wanted, this is what I wanted. So
you were forced to kind of live what you preached.
well, yeah, and one of the last things he said to me was, "I love you for letting me do this," because he knew that if he had been married to somebody else, I mean, it's quite possible that somebody else might not have been that supportive. And so we chose that. And luckily, we had enough time for his family. He had family in town to come visit and say goodbye. My family is out of town. They came in and said goodbye, and he chose this. And I spent 2 nights at the hospital with him, and he died overnight. So it was a lot to take in. It was 3 months from his diagnosis to his death. But he died the way he wanted to die.
And this was back in 2007, so it's been...
Oh, no, it was 2002.
Okay, so this has been...
So it's been 15 years.
Mm-hmm. Okay. So we'll come back to some of the maybe legal side of this in a bit, but Bev, you had a story when you were younger,
Yes.
I believe.
In 1970, when I was 18, so things were a lot different.
Everybody can figure your age now, right?
Yeah, that's right, yes. My mother had cancer, multiple myeloma, which is cancer of the bone marrow. And at that time, they had very little treatment options available for it. They tried a little bit of chemotherapy. Basically, she was at home for 9 months, ill, and we went through the whole thing of helping care for her during that period of time. And near the end, I would say it's the same as what your husband had, the palliative sedation. That was back in the day when we were out in a rural area. Doctors still came to your house, so morphine was, treatments were, not treatments, but morphine was given to her, and she went into a coma for about a week before she died.
That's interesting, because I think a lot of people don't realize that this has maybe been practiced to some extent that long ago, maybe even longer, probably.
Yes. Yeah.
So did you kind of stay out of school during that period of time?
No, I went in to school late and came home early, get my study halls, how they were back then. And we had a family member or neighbor come in the interim.
So you both have gotten involved with this organization. So why are you involved with it, and what is this organization trying to do?
Compassionate Choices is a national organization that's been around for over 30 years, and their goal is to give, as Susan has discussed, give people options as they near the end of life from a terminal illness. We're not talking the full range of issues that people might want more choice than they have. At this point in time, they work toward working for people who have a terminal illness and are within 6 months of a doctor saying they're within 6 months of the end of their life. Can there be additional treatments, medical aid in dying available for them? Now, Compassionate Choices also works on making sure just that people know the full range of options that are available to you, which include the palliative sedation, hospice, voluntary stopping, eating and drinking, as well as in 6 states and the District of Columbia now, medical aid in dying.
So this is interesting because it has to be 6 months. I guess I've heard so many stories about people who have a terminal illness, but they don't know, or it's an illness that's going to be progressive to the point that they're just going to lose control of their body, but it could take years. But at some point, they're really not there anymore, and how does that fit in for this organization, or for even how you look at it, Susan?
A doctor has to sign off on saying that they believe that the patient has 6 months or less to live. So, some of this is just, the art of medicine, and sometimes doctors are wrong and patients end up living longer or less. But, this is the doctor's estimate of the time remaining to the patient.
Well, the one that sounds horrible to me, and I'm not really good with medical stuff, so the one that sounds horrible to me is kind of losing the ability to breathe, and you kind of slowly choke to death kind of thing. And I hear people who have that, but it sounds like it's going to be a long time. But they're like, I don't want to live like this where I can't breathe. Or somebody who's in a situation where they're losing all their body function, and their mind's going at the same time. How do you see that? I understand the 6 month for this organization, but how do you both kind of view that for people who aren't at that 6 months?
Well, they do have to be competent. That's another thing. So as far as their mind going, they have to, all the states that have passed the legislation so far, and in the future too, I suspect, the patient would have to be competent. So in addition to having that 6-month time frame, we want to make sure that the patient is understanding what's going on. We don't want anybody else making the decision for the patient. I mean, this is really, the idea is to enhance patient autonomy, not to have other family members say, now, I'm going to make the decision for you.
So what do you do if the person says, right now I'm competent, I know I have this disease, I know I'm going to die, they're giving me 6 months to 2 years, but I know at some point my mind and my consciousness is going to disappear during this process. I want you, Bev, my spouse, or somebody, I'm signing this over, that when I get bad enough, I want you to go ahead and it's okay for me to go.
This legislation would not cover the person doing it 6 months to 2 years in advance. It has to be the two doctors. Two doctors have to have said it's within 6 months. Then if it is, there's a form they fill out, they sign it, the doctors sign it, and then they still have to go back even 15 days later and sign it again to make sure they haven't changed their mind.
Well, I want to know how you both personally feel about the scenario I just laid out, though. How you personally feel about someone saying, look, I know at some point I got dementia. I am not going to know who I am, what's going on. And if I get to that point, I really don't want to be alive. So can I give permission to somebody to let me go?
So personally, I'm sympathetic, but the legislation doesn't go that far.
Doesn't go that far.
Yeah.
Okay.
Yeah.
But-
And then there are no plans at this point in time, through Compassionate Choices at any rate, to go to that point.
So tell me the sympathetic side of that for you, because you teach this death and dying class, so you must talk about some of these issues.
We do.
Right? So talk to me a little bit about what are some of the issues involved in that.
Well, we talk about things like what makes you unique and what makes you you. And when you start to change, especially like a case like dementia or Alzheimer's, is characterized by personality changes, and the person that you are becoming is not the person that you were. So it's understandable that somebody might want to think about medical aid in dying. However, legally that is somewhere where this organization is not willing to go.
Right. Well, I'm going to ask you this more personally than I understand about the organization. But I'm seeing, and we see this, they say, this person's got a healthy body, they're 85, but their mind is completely gone, their body is completely gone, they're just bedridden, there's really, but they might live for another 8 years, just laying in bed, doing nothing. And there's nothing unique left of them. I mean, where do we stand? I mean, I understand kind of legal. I mean, what's your take on this, or how do you look at it, or what do you say to somebody who's in that situation? Who's the family?
Well, there is no legal way they can do it. I personally totally relate to that experience and personally would not wish to be in that situation myself. What alternatives there are for me, those become extremely personal, I guess, at that point in time, but they aren't legal, and it certainly would not be legal, and it would put a family member in, legal jeopardy to assist me, even if I was to the point of begging them to do so. It would put them in legal jeopardy of being held, guilty of potentially murder or assisted suicide or something of that sort. And so, that would be a very hard decision also to put a family member in that position.
So some people work around this, though, don't they? I mean, what are some of the workarounds that we hear about? Are there workarounds? I know this is a tough subject.
Yeah.
I don't know. I mean, you could probably stash pain meds, other meds.
I mean, people can commit suicide, right? I mean, they may say,
Yeah.
I've been told again, I may have 6 months, I may have 3 years, but I don't want to live like this. And no state right now authorizes that kind of, they would consider that a
Right.
suicide, right?
Correct. Yes.
So is that an assisted suicide?
No.
Can't be done?
No state currently has legislation that
Right.
allows
And
that.
but if it's done within the 6-month period, what I find kind of interesting is if it's within that 6-month window, the thing that I find most interesting is quite a large number of patients have chosen to get the meds and then have chosen not to use them, and they end up dying of their illness. So I just find it interesting that they find comfort in having the prescription even if they never use it. Like for instance, in Oregon, it's been legal, this medical aid in dying has been legal for 20 years now, and the number of patients that have taken advantage of the law is something like 1,000. And I think most people are under the impression it's a really huge number, but it's not. So I think that the number getting prescriptions is actually much larger. The number actually using them is much smaller, which I think is probably appropriate, that people are taking this very seriously.
It's about a third.
Oh, okay.
I looked up the numbers.
Okay.
There's about a third of the people in Oregon. This is all Oregon has all the statistics because it's been in place for 20 years. About a third choose not get the prescription, but don't use it. So it's about, I now have control.
Okay.
And they answer a survey to that. They all have to answer a survey to why are they seeking this prescription? And autonomy, 92% of people say autonomy is their number one reason.
Now, is this prescription for treatment or prescription
No, prescription
for...
for end of life.
For end of life.
Yeah, so the
Yeah.
meds. And so I think that's interesting also. So autonomy is more important than pain control.
Yes.
And everybody always talks about, we need to get doctors. The big issue is doctors can control pain. Doctors can, they've got all these, great drugs now that can control pain. But no, for a dying person, the big issue is autonomy. This disease is affecting me, cancer, whatever it is. I have no control because of cancer. I can control the manner in which I die, or I can even control whether I choose to take this or not.
Well, if you take the pain meds sometime, you lose your ability to think, right? I mean,
Yes.
you're not
Yep.
really conscious any longer because the pain meds are so
Right.
severe. So haven't you almost given up your life at that point if you just say, no, just load me up with pain meds. I realize I'm not going to probably have any more conscious thought, but I won't know it. So I'm okay. Just load me up with pain until I die.
Mm-hmm.
Yep.
That's another choice. Again, it's giving more choices to patients. So if a patient chooses to end his or her life that way, comfortable but not very wide awake, not able to have many meaningful conversations, that's a patient's choice.
I think this seems part of it so clinical when we discuss it, but for the patient, this must be horrible to be in the spot where particularly you're going to go through a painful death, or a loss where you're just really not even going to be able to communicate or function well, or you just have to be there and you're conscious enough to watch people just take care of your body, and it just feels lousy. More than lousy, it feels horrible. I mean, what do you say to those people that say, I don't want to go through this. I just really don't want to go through the indignity of this. I don't want to go through this much pain. I don't want to die a horrible death.
Well, one of the cases that brought this to national attention in the last couple of years was a young woman who was only 30 years old, Brittany Maynard. And a lot of people know that name now because she had a brain tumor. And she lived in California where this was not legal at that time. And she and her family moved to Oregon so that she would be able, because she made the decision, I don't want to die that long, protracted, painful death. She had 2 young kids. She wanted to be able to have her family around her, and she did exactly that. There's YouTube videos about her talking about it near the end, that this is what she wanted, to be able to go in a more peaceful manner before the pain became intolerable.
Does the 6-month rule exist there also?
Yeah.
Did she have to be within 6 months?
Yes, yes, absolutely.
And again, that's pretty subjective, so you can find, I assume, a doctor who would say, this could be 6 months. And you could find one who would say, this could be 3 years.
But they have an obligation, an ethical obligation to be true to their profession. So I don't think that there would be a lot of abuses of that.
Well, and the legislation requires 2 doctors
Yeah.
to say it.
So does it count if the 2 doctors say it could be as soon as 6 months, but it could be as long as 3 years? Does that qualify?
I honestly don't know the law well
Yeah,
enough.
I don't think they can give a range. It has to be 6 months, like their professional belief that 6 months is the expectation.
That
But-
there's no longer than that.
Right.
They have to believe that.
Yeah.
Right.
Do you have people come to you and want to talk about this issue?
A few, not a lot.
I would say not a lot either.
Yeah. And in my class, it's been kind of interesting because I get the impression, because I'm teaching people, most of them are in their 20s and 30s, I get the impression that this is the first time they've had this conversation. And so it's been really interesting to kind of force younger people to think about some of these issues.
At a national level, Compassionate Choices does a lot of counseling. They actually, if someone's going through this and needs help to figure, to even talk about it and talk about the options and all that, Compassionate Choices has people on their staff at a national level that'll reach out and talk to people.
But for most people, who do they end up talking to? I mean, for most families or patients, who do they end up talking to?
They don't talk to anybody, and then grandma has an emergency in the hospital. They have to make a decision about whether to remove her on the respirator, and they have the first conversation that day. That's what happens.
That's not the right thing. That's not a good thing to do,
No,
right?
because first of all, you don't know what she wants, what her wishes are. So one of the things I tell my students is go home and tell at least one person in your life, your spouse, if you're married, your parents, if you're not, what your wishes are. So if something happens to you, there's at least one person who knows what you want.
So in Indiana, kind of where do we stand right now? Because you're working on some legislation,
Right.
and we're down to a couple minutes here.
Right. We have introduced this last legislative session, Matt Pierce, who's a representative from Bloomington, introduced into the House, and Senator Lonnie Randolph from here in Northwest Indiana introduced into the Senate, into committee, medical aid in dying legislation that follows the pattern that would be Oregon, California, and the 6 other states that have this use. And that went into committee. It did not get heard last year, so our goal this coming year is to try and find, we do not believe this is a partisan issue, so we're hoping to find a Republican co-sponsor in both the House and the Senate, and to get the committees to actually hear
Indiana
this
tends
bill.
to have a reputation for waiting a long time and being one of the last states to adopt things like this. Is that your fearful prediction?
Well, it's a conservative state, so we know that going in, that we're just going to have to keep going at it. But we're real pleased with getting it into committee as a first step this past year.
Do you feel like people generally would support this?
Nationally, all the recent surveys, Gallup does a survey almost every year. The last 3 years, it's nearing 75%. It's somewhere between 70 and 75% of all Americans. I haven't seen Indiana statistics, but nationally 75%. I don't know why Indiana citizens would be different than the norm in this case.
So-
And that's conservatives and more progressive.
So down to our last few seconds, what would you say to encourage people to have these conversations in their family?
I would say that everybody's going to face death, and if you want to have a good death, make sure that people know what your last wishes are.
Okay, we're at the end here, so I really appreciate both of you coming here and candidly talking about this. I hope this helps other people think about it and talk about it. I know it's going to be a conversation around my family for the next few days, so thank you for being here. Appreciate it.
Thank you for having us.
You bet. We live in a country that values freedom, the freedom to choose, make our own decisions, do what we want. The freedoms of religion, speech, and press are clearly stated in the First Amendment of the U.S. Constitution. The question is, are we truly free to make choices for ourselves? You are free to drive your car as fast as you can. If you do it all the time, most likely you will receive lots of speeding tickets. At some point, your driver's license will be suspended and you won't be able to drive legally. Still, you have the freedom to keep on doing it until you are placed in jail, and now you do not have the freedom to drive. You are free to live an unhealthy lifestyle, overeat, no exercise, lots of junk food. You can do that for a long time or not before you become ill. Then you are placed in a hospital and they control your diet. Oh, you can have your favorite relative sneak some food to your bedside until the hospital personnel discover it and assign Nurse Ratchet to your room. Now, you do not have the freedom to eat what you want. You have the freedom to scream as loudly as you can, run naked through the streets, howl at the moon, and babble uncontrollably. Yes, you do. Until someone reports it, or you disturb everyone in town and the police are dispatched to make you stop. Again, you can continue, but it will probably be inside a cell. If you don't stop, I am quite sure a judge will be happy to send you to a place where they can medicate you or modify your behavior until you no longer yell, streak, hoot, or ramble. This list could continue with examples of a water pistol at the bank, joking about hijacking your plane, or yelling fire in the theater. Bottom line, there are restrictions to freedom. If you've noticed, all the previous examples were impacting others, endangering drivers, disturbing the peace, frightening people, and creating cost for police, courts, healthcare, and security, all shouldered by the rest of us. What if the decision to choose had no or little effect on others, and the impact was viewed as positive by those close to you? What if the mind and body were unable to function, and the decision would be a significant reduction of cost, worry, care, stress, hardship on those whom you love? What would you do? It's a tough challenge and one we have explored on this show. When your time comes to face this question, and many of us will on one side or the other, I hope you have the freedom to choose. Thanks for watching. We appreciate every time you turn on Lakeshore PBS and view one of our shows. Your comments about any of our interviews on Lakeshore Focus are helpful to us. You can send your thoughts through the website or via email, both listed on your screen right now. If you can't find a previously aired show on our website for some reason, go to YouTube, type Lakeshore Focus, and perhaps the name of the guest or topic you want to watch, and zing, there it is. Be sure and join us again next week for another Lakeshore Focus. Until then, I'm Keith Kirkpatrick saying, make a positive difference in our world today.